one day I just noticed I had some rashes, like if I wouldn't shave over the weekend, hair wouldn't grow in certain areas of my face. So I went to the doctor, it was a dermatologist, and she said, oh, we'll give you some cream, and that'll be about it. And after a couple weeks, the cream didn't do anything. It was Friday the 13th. I was in the hotel in the morning and I got a call from the doctor saying, hey Chris, this is Dr. So-and-so, you need to give me a call back. She said, you've got cutaneous T-cell lymphoma. And I said, well, what does that mean? What's my prognosis? And she basically said, I don't know. I've only seen it in a textbook. And here's the number for University of Pennsylvania Hospital. And that's it, click.
When my doctor first said to me, you have cutaneous T-cell lymphoma, my entire life changed at that point. When I went to the doctor, I thought that I just had a little rash. I started out by doing phototherapy 3 times a week, and it cleared my skin pretty well, and I thought this was going to be pretty easy. And then it stopped working for me.
I was 30 years old when I was diagnosed. I had been married not even 4 months. And it was a life-altering event. I went through a lot of different types of therapy all at once for about 1.5 years. I lost about 35 pounds. I don't have it to lose, and it was a tough couple of years.
Right now, I have learned how to live with this disease. It's a part of me. And living with cancer is not all bad. I live a very normal lifestyle.
After being initially diagnosed, you felt like you were a broken person. You thought people could see it on you, and it was a much bigger part of who you were, and it was something you sort of, it was always there. Now it's sort of something it's still there, but it's much more in the background, which is nice.
A lot of times, patients will say, I can cover this up so nobody knows what I'm dealing with. And sometimes that's lonely.
I couldn't shave. If I would talk or chew, my face would crack and bleed. Being young and sort of, I didn't want to go out, I didn't want to be seen. Go to a store and kids would look and point. It was a trying sort of time.
Most lymphomas are internal or systemic lymphomas, and a cutaneous lymphoma is skin-based in that it appears first on the skin instead of internally. So most cutaneous lymphomas are diagnosed as something on the skin. The vast majority of them won't go away. There are some that actually wax and wane. All cutaneous lymphomas essentially are eruptions on the skin that don't go away, and that usually they're treated with common treatments for which they don't respond.
If I could have gotten chemotherapy, I would have, because I wanted to just hit it hard, quick, have a bad year, and be done with it. But that's, now I know that that's not the smartest way to handle things. You don't necessarily have better outcomes by going that route.
For this disease, there is a strong component of immunotherapies as opposed to chemotherapies, so that the disease responds to a variety of immunotherapies which manipulate the immune system to regulate the disease and develop an anti-lymphoma response to the disease.
Because patients don't hear a lot about research for this disease, they don't think that anybody's out there for them. But there is a lot of research being done, and there is a lot of hope for the future.
People should have a picture of their skin in their mind's eye, their moles, their freckles, and that if something is growing on the skin, whether it be a nodule, a lump, or a rash, okay, that is red and scaly, they should investigate. Most things on the skin will respond to treatment. There are chronic diseases of the skin, so that I guess the call to action is if you see something new on the skin, persistent on the skin, it should be checked out.
I had been running a listserv to bring patients together basically because I needed to talk to somebody. And this was a way that I could connect with patients. And Dr. Stuart Lesson heard about it from one of his patients.
The foundation was started with Judy Jones, who was a patient, and her life story and her journey with this disease is really at the heart of the foundation.
It's allowed me to live a normal life and not life as a patient. You know, I'm able to have a career, I'm able to have a family, I'm able to have a social life. It's helped me and shown me that all that is still possible as a patient.
As the foundation grows, we are going to be able to help more patients. We are going to provide more awareness with physicians, and we are going to make a real impact in this disease.
The foundation really needs funding. That's the lifeblood of the foundation. It lets us get out to the community. It lets us sponsor research. It allows us to, show people where to go for treatments, depending on where they live.
The Cutaneous Lymphoma Foundation makes sure that the voices of patients with cutaneous lymphoma are heard by legislators who shape the policy that affects their lives. We help tell their stories and make sure that our legislators understand the important issues that can help improve their lives, such as advocating for increased funding for biomedical research and access to treatment therapies and medical reimbursement. These things are very important to our patients, and our foundation is truly at the forefront of making sure that their voices are heard. The Cutaneous Lymphoma Foundation enthusiastically invites everyone who's inspired to partner with us in our life-changing work. You can help by volunteering your time, becoming an advocate, creating a special fund in honor of someone you love, or by making a donation. Please log on to www.clfoundation.org or phone us at 248-644-9014 to learn more. Together, we will make sure that each person with cutaneous lymphoma gets the best care possible.